Welcome to another segment of our Partner Spotlight series, brought to you by the members of the Regional Chronic Disease Collaborative. The Regional Chronic Disease Collaborative members work together, combining their resources and expertise to help prevent the development and progression of chronic disease across our region. Our Partner Spotlight initiative is to help share innovative approaches being used throughout our region to improve population health.
Welcome everyone. I'd like to introduce Teresa Weyer, a registered nurse and the chronic care manager with Memorial Hospital of Sweetwater County, located in Rock Springs, Wyoming. She is here today to share a little bit about the positive work and services she and her team is providing during annual wellness visits and the importance of team-based care for their patients. Welcome, Teresa. And how are you doing today?
I am having a wonderful morning. Thank you for having me.
Now, to start us off, why don't you share with us a little bit about the program, or just an overview of the services during annual wellness visits and how the Memorial Hospital of Sweetwater County directed their focus on team-based care.
I am part of the chronic care management team for our internal med and our family medicine clinics. Our team is fortunate because we figured out who did and who fit best in the programs that we offer, chronic care management and Medicare annual wellness visits. And I showed a propensity to the Medicare annual wellness visit. So that is what I provide. I work with, as I say, our family med docs. So I do a lot of, they're my team. Their MAs and nurses are my team. My chronic care manager, I work with a chronic care manager. She's part of the team. We work throughout the hospital with many different people to ensure that we're meeting the needs of our patients that we see for the annual wellness visit. The Medicare annual wellness visit is a Medicare visit that is 100% paid for by Medicare. And if you're on Medicare Part B and you've been on Medicare Part B for a year, that's when I bring you in and start this process.
Nice. Would you share how this program and services has evolved and developed? And more important, why?
Yeah, sure. So I started a while ago, and we were just getting it up and running. And so it was a lot of education to the providers. Here's what we're offering. Here's what we need. Here's what we do. A lot. And when we started this, we were doing cold calls. We were just calling people, looking at the schedule and seeing people that might qualify for an annual wellness visit or might be interested. And so it was kind of interesting at the beginning, picking up our numbers and getting people involved. And through education of the staff, through support from leadership, and from support from the medical staff, we were able to start a really nice referral process.
More specifically, what are the key goals of the program in which you and your team focus on directly to assist in improving the patient population within your community?
You know, I thought about this, and I think about this often. I think that the key goal of the annual wellness visit that I provide is that this is a patient-centered visit. That the patient, I tell them when I start the visit and explain the visit, especially on the first one, this is your visit. These are your screenings. This is your wellness plan moving forward. So what matters to you is what matters to me in this visit. I want your chart to be a medical home. So we have a place where we know all the people you're seeing and all the services that you're getting. So we have a really good picture of your physical, mental, and emotional health. But I also want, through my work and through the work of the annual wellness visit, to get a picture of who you are and what you want and what you feel your health looks like now and what you want your health to look like in the future. And I think that has made a huge impact in some lives, because people are like, this is the first visit where I've just been able to tell all this stuff because I have the time for it. In the annual wellness visit, that's our goal.
Would you describe your project or program and what concerns or problems you wanted to address?
Yes. So the Medicare annual wellness visit is my project. What problems did I want to address? I wanted to make sure that the patients that we serve in our clinics at Memorial Hospital were getting the screenings that Medicare will cover to ensure to stop or to prevent or to identify early in the disease process, things that are changing and going on with them. We do that through lab testing. We do that through screenings for fall risk, for screenings for memory and issues like that. That helps us prevent future things. And that was our goal, to get people more involved in their health in the future and to get screenings that they qualified for done.
Would you provide an overall breakdown of the annual wellness visit and explain why team-based care is important?
So right now, a lot of my annual wellness visit referrals are coming from the providers. And the providers know these people. They've had them in there and they said, I think you'd benefit from that. So I already have their support. The annual wellness visit, I'm able to spend time and do a little bit more screening work and finding out some background history on what's going on. The other thing that I find out that I feel is beneficial is oftentimes, because we've got that rapport and we've got that time, patients will tell me things that might not get brought up in a visit with their provider. I always think that people tell me more about what medicines they're really taking at home than perhaps what they'll tell their provider. And I'm able to make that note and share that with the provider. I send an SBAR, the note format that we use to inform the providers of the visit that I had, and it outlines, here's what we talked about. Here's the medicines that they're not taking routinely. Here's the blood pressure log that they are taking at home. Here's the vitamins and minerals that they're taking. So there's a lot of communication in writing and then face-to-face with the providers. So it really makes a difference with the team.
Now, and to better understand the direct impact of team-based care, you and your team work in conjunction with other programs, agencies, and organizations across the community and state. Would you explain why these relationships are important to you and relates directly on patients' diagnosis?
One of the areas that chronic care management has and the commitments is to be a community partner, because we're not alone. We cannot do things alone. And community, sometimes we just think about maybe your hospital, maybe the local community, but statewide in Wyoming is especially important because there are so few of us. And the cooperation and the collaboration that we have with the Wyoming Department of Health, Chronic Disease, really helps us provide the best care, because we get data, not only of ours, but of the state to see where we're at. And a lot of education comes to help us guide our patients and our providers on the services and where we should be in our numbers and how we can move forward. I use a lot of the education sources. I refer a lot of my actual patients to the programs that the Wyoming Department of Health and the University of Wyoming and many of our other providers offer. And it's been really valuable for the people in our community.
Now, would you like to be able to elaborate on any metrics or data points you're monitoring for this program?
Yeah, I can speak directly to that because Chronic Care Management annual wellness visit is reported on quarterly for our process improvement team. When I went back and looked, even if I didn't do a visit from 23 to 24, I took the data to see if the results had been done. My goal was 50% of the recommended and agreed upon screenings being completed, and I was at 62%. So I was very excited. What I did note during that, when we talk about process improvement, I found some of the barriers to that. And one of them was getting the orders in. And we changed that process. The providers now request that I send the proposal for these orders to them and put them in right after my visit with the proper diagnosis codes and things like that to ensure Medicare reimburses, and the proper screening codes. And they look them over. I've not had anybody say no. The providers then sign those proposals. So the orders were being entered timely. Also, we found some scheduling conflicts, and it was staff related. So I changed my education in the visits from they will call and schedule to, if you don't hear from them within the week, call this number, and I give them in the wellness plan that I provide the actual number.
Would you be able to share who is referred and enrolled in the program or services at your location?
Yeah, so the annual wellness visit, anybody that has Medicare Part B that's had it for more than 12 months can have an annual wellness visit. Chronic care management we take referrals. People can call and say, I'm worried about a person. And we like the referrals to come from the provider because they're the ones who are going to be accepting the care under chronic care management for those people. So it's important for those patients to come from the doctor. But for me, anybody, the reception staff, the billing office sends me people they're concerned about. So it's a hospital-wide kind of event and support for this program.
Do you have a particular story that you would like to share about a patient's experience and how team-based care impacted it?
I see so many people that are now excited to come back in, and they're following up on their medications better. They're taking more active participation in their health care. They're signing up for the portal. I work with people to make sure they've got their email addresses so we can send them things. Just more involvement in their health care. I see a lot of that. Some of my patients now that I do annual wellness visits, they call at the beginning of the year and they want to schedule their July appointment.
What aspects of the program are you most proud of?
Getting the screenings done, the collaboration that I have not only in the hospital and the support that I've received for this program, but in our community and how people know about it, because I've talked so much about it and been out there. The Medicare annual wellness plan. I am so pleased when we look back on when we started the program, and your services always improve. Every patient and every person that I see leaves the office with a written plan of what they've decided they're going to do in the next year for health and wellness. That plan has evolved exponentially. Now it not only covers the things that the screenings that Medicare will do, I offer education. I'm cutting and pasting every year. I update it to important things or things that I found in the last year that there were a lot of questions about from the Medicare and new handbook. I'm doing some cardiovascular education added on to that. I put their immunizations in there.
So what is your role within the program at Memorial Hospital of Sweetwater County? And what advice do you have for others who may attempt to implement a program like this one?
So I am the Medicare annual wellness visit provider. We went with a nurse, a registered nurse, because we wanted to keep it a wellness visit. I think when we were getting started, you have to build trust with your providers. No one wants anybody going rogue and doing odd things. And the education, so there was a lot of education. We did identify some of the issues with making sure that scheduling was done, making sure that people were following up, telling people and educating patients on services that you recommend that they have. Takes more than one visit. So maybe that first year, no, that second year, I'll think about it. And then by the third year, yes, I think I'm ready. So just getting buy-in from the patients and getting them ready and trusting that what you're telling them is going to benefit them. Yeah. Anybody that wants to do this program, I cannot encourage it enough. Jump right in. There's education. There's certificate programs for this, which I took all of those to make sure that we were offering the program. And that the benefits to the patients were another touchstone in their healthcare, in the healthcare system here.
Teresa, again, I wanted to thank you for your inspiring work that you and your team are doing within your community and willingness to participate in our Partnership Spotlight segment. Thank you.
You're very welcome. This has been a pleasure.
If you are interested in sharing your innovative approach, please contact one of these Mountain Pacific representatives. Thank you.